The rural areas, where majority of the populations of developing countries live. Conditions in rural dwellings are almost always the same. Lack of roads, electricity, pipe-borne water, and decent housing. Quality education and healthcare are difficult to come by, and poverty is rife. These conditions always expose rural dwellers to preventable diseases, including malaria, tuberculosis, and all forms of childhood illnesses. In most developing countries, the absence of basic amenities makes healthcare delivery an uphill task. This also jeopardizes the attainment of the health targets of the Millennium Development Goals. However, one country which seems to have found a way around the challenges of healthcare delivery, especially in its vast rural areas, is Ethiopia. In 2003, the landlocked country located in the Horn of Africa introduced a health extension program aimed at bringing health care to the rural areas and reducing the high rate of maternal and child morbidity and deaths. Under the program, health posts were created in every rural community of between 3,000 and 5,000 people. Health extension workers were engaged, trained, and sent back home to man the health posts, and the results have been remarkable.
1990, where the MDG baseline starts, it was 1,040 deaths per 100,000. This is maternal deaths. Now we're, according to recent WHO estimate, it's 470 per 100,000. So the reduction is more than 55% the last 20 years.
Ethiopia has the second largest population after Nigeria on the African continent, with 85.2 million people, of which 77.3 million live in the rural areas. Before the health extension program was initiated in 2003, Ethiopia was one of the 57 countries in the world with an acute shortage of health workers. A reason why Ethiopians, especially those in the rural areas, died needlessly from preventable diseases. For instance, 60 women died daily from complications arising from childbirth.
One of the issues that we've had in Africa, and indeed in most developing parts of the world, is that access to care is not guaranteed. And because, the posts are so far away from people, they tend not to go.
34,000 health extension workers have been trained so far by the government with help from UNICEF. 15,000 health posts have also been set up throughout the country.
We work with the community in this Worada, and this district has 40 rural cabals. And in these 14 rural cabals, we do have 19 health extension workers, and these health extension workers are distributed to each cabal, each district, and they are working with the community. And they are trying to change the lifestyle of the community.
To ensure the success of the program, the government had to embark on a massive provision of basic amenities in the rural areas, including access roads, electricity, telecommunications, and potable water.
One of the delays in, during delivery, when they seek assistance of skilled, assistance is the distance from home to health facility. So there should be good road and transport system in order to bring the mother to the health institution on time. So it's really helping a lot, and Ethiopia is really progressing well in terms of, fast expansion of roads and other infrastructures.
With these in place, getting trained workers to live in their rural communities became easier. The program has attracted the attention of the United Nations, which recommends it for other African countries which want to meet the health targets of the MDGs.
This may look like a very elementary level of sanitation and medical support, but they are the first line lifesavers, and I'm very much grateful.
The Health Accession Program is a deliberate shift of Ethiopian government's attention from curative public health care to promotive, preventive and selective curative services.
I'm very much encouraged by what the Ethiopian government is doing. I'd like to again discuss this matter with the world leaders, traditional donors, so that they can encourage this sanitation and health service.
With just 4 years to the 2015 deadline for the MDGs, it has become imperative for developing countries to find innovative ways of meeting the targets. Osiregbeme Lama, AIT News, Bahir Dar, Ethiopia.